You may be familiar with breast cancer, lung cancer, or prostate cancer, but there's another type that many women are at risk of developing. Preventing it starts with making sure that certain women do one specific thing each month. News Channel 6's Renetta Dubose joins us live in the studio now with a closer look at endometrial cancer.
Having a period each month can be a dreadful activity for some women, but it's also a lifesaver. Women battling PCOS and irregular menstrual cycles can develop endometrial cancer, and doctors here say they are diagnosing more cases.
In the last 3 to 4 years, I've seen about 12 patients with PCOS-related endometrial cancer.
No one wants to hear the word cancer, but doctors who treat polycystic ovary syndrome at Augusta University are seeing more and more of it, and the 1 in 10 women of childbearing age who battle the chronic disorder.
With PCOS, you have a relative increase of estrogen relative to the levels of progesterone, which is the other female hormone, and this causes thickening over time of the endometrial lining.
Dr. Bunja Runrang tells us that because women with PCOS have irregular periods, not enough progesterone is produced to oppose the abundance of estrogen in the polycystic ovaries. Extra estrogen also comes from fat tissues, another danger because women with PCOS have difficulties with weight loss. Endometrial cancer is most common in postmenopausal women between the ages of 50 and 70, but younger women battling infertility are getting it too. Her youngest patient, just 21 years old.
Unfortunately, when I'm seeing women in their 20s and 30s who haven't had kids yet and really want to maintain their fertility, talking to them about a hysterectomy becomes a major problem.
Hormone treatments help, and that's where Dr. Larissa Gavrilova Jordan steps in.
If your periods are 35 days or longer and you're not pregnant simply by testing pregnancy test at home, it's time to get progesterone.
She adds that birth control helps regulate the cycle for women with PCOS, but those trying to conceive come off of that regimen and are at risk for endometrial cancer.
Predictable menstrual periods can also lead to other problems such as endometrial polyps. Endometrial polyps commonly benign and lead just excessive bleeding and clotting, causing women prolonged periods of bleeding when it comes, and eventually still could turn into that cancer.
Taking progesterone really is not that difficult. Dr. Jordan says it is typically an oral medication taken over 10 days, and that brings on the much needed menstrual cycle and helps those with PCOS avoid the risk of cancer.